My Greens, how are you? I'm Michael O'Neill. I'm a staff organizer for the Green Party of New York, and this is How Greens Get Things Done. Every Sunday at 4 p.m., at least as many Sundays as I can, we gather here in this online Facebook Live video space to talk about the tips and tricks and techniques that Greens need to get things done in their campaigns, in our work in issue movements, and to build our party. And so today, we're going to be running through how to crunch the numbers for how much money the New York Health Act would actually save New York municipalities, counties, districts, etc., if we had a universal, everybody in, nobody out, Medicare for all type system in New York State. And pushing for the New York Health Act is one of our major initiatives for the Green Party of New York in 2017. We are proud to be part of the New York Health Coalition that is fighting for the passage of the New York Health Act. We were one state senator short of passing that this past session, and so this is a great time to be out on the streets talking to folks about this issue, getting the data into our campaigns for local office and for Greens who are doing county building where maybe they don't have any candidates this year. Talk to people about the New York Health Act, get their healthcare stories, and to get the right information out there about how this would actually not just meet some of the health crises that we are facing in New York, but also some of the budgetary crises that afflict many of our municipalities, towns, councils, villages, cities here in New York State. So there are a couple things I want to talk about here today. And the first item is the actual numbers for what this everybody in, nobody out, healthcare for all, universal insurance system would save people, how to calculate those savings for your county or town. But another thing I want to talk about is the upcoming community canvassing day that the New York Health Coalition is pushing for on September 23rd. And I want to let you know how you can get involved with that in your community, how as part of your local Green Party group or even your campaign, you can get your community canvassing effort on the map at the New York Health website. And this is one way that we can add value to this coalition and that we can be, talking to new people on an issue that matters, that affects their lives, and helping to build a relationship with them in terms of the Green Party as an organization and a party and a group of candidates that is fighting for issues like this. So maybe I'll just give you a teaser real quick of what this community health, this community outreach day is going to look like before I get into the numbers. And I am going to attempt to address your questions as we move along here. I do have the question feed for this live stream up on my second monitor. So as you post questions there, I will do my best to answer them. Keep in mind that you are seeing live video that's about 30 to 40 seconds behind my experience of reality. And so I will do my best to make sure that I'm leaving enough time for people to get questions in before I transition to another topic. All right, so moving to the magic window here, if you go to the Campaign for New York Health website, which is at nyhcampaign.org, at nyt.org/September 23, 17, there's a statewide day of outreach for New York Health, and you can go there to get a sense of what this is about. Again, I'll talk about this a little bit later in the program, but we want to have a network of community pushes throughout New York State to go door to door in communities, talk to people about this issue, find out their healthcare stories, how financial barriers have kept them from getting the kind of healthcare that they need, and enlist them in the fight for passing this important bill. So again, you can find this on the New York Health Campaign website, and the statewide day of outreach is September 23rd. That's going to be a Saturday. Now, you can get materials for such a day of outreach by going to gpny.org/healthcare. Again, that's gpny.org/healthcare. And on that page, we have instructions for how to calculate New York Health Act savings for your district, town, city, or county, like we're going to talk about in a moment. But we also have outreach materials. We have got a 4-on-a-page postcard. We've got a petition for single payer. We have the New York Health Campaign survey, where people can talk about their experience either seeking or being denied health care, and also a petition for business owners, self-employed people, and freelancers. That's an important voice to include in this coalition, because a public health insurance fund that everybody in and nobody's left out of would do a lot to relieve the healthcare cost burden for freelancers, for self-employed people, and for small business owners. All right, so that's a teaser about that upcoming day of action on September 23rd, day of community outreach. And let's now move into how to actually crunch the savings for what the New York Health Act would do for your community, your county. And this is an important piece of your messaging when you are talking to people door to door, but also when you're talking to the media. If you're a candidate for office or you're part of a campaign, this is a great thing to include as part of your campaign. And again, that we have health crises across the state, but we also have budget crises across the state, and these are linked. We spend so much money on for-profit, ineffective health care that we seemingly face budget shortfalls when trying to pay for things like schools and infrastructure and any host of other services that people need. So this fits into a larger macro Green New Deal program. So the way we are going to calculate these healthcare savings is, again, you go to gpny.org/healthcare, and under Calculate the Healthcare Savings for Your Community, we have a Word document that has some instructions, and then we have a spreadsheet that contains some formulas that you can use to help crunch the numbers. And I've already downloaded those. I'm going to open up my spreadsheet right now. And then so we have a New York Health Assessment Worksheet, and these are materials, templates that we've obtained and adapted from the New York Health Campaign. And if you take a look at the Word document, it also gives you a link to where you can find the spreadsheet online. And if you don't have Microsoft Office on your computer, you can go to LibreOffice.org and download that software suite for yourself. Runs on Windows and Mac. I'm using LibreOffice in this tutorial. It is a free and completely legal, safe to run software suite that gives you a word processor, spreadsheets, presentation software. I've been using it for, well, maybe about 15 years now, maybe more than that. And back when it was OpenOffice.org is how it started, and there was a fork. Now there's LibreOffice and OpenOffice. You can use either, but you will need some software. Now, if this kind of thing is very difficult for you, this is a great task or initiative to delegate to someone in your Green Party county or community or your campaign who is more inclined to work with numbers. Now, as I've mentioned on previous episodes of How to Get Things Done, I was a theater major in college. this kind of stuff does not come naturally to me, but the instructions as they have been drafted in this worksheet packet are pretty effective, and we've done what we can on our end to try to tighten things up there, and I'm gonna go through it with you step by step right now, and you can see what I'm seeing, and maybe that will help some questions that you have about how to do this. So I see a couple comments coming in, but nothing specific to the topic of conversation in this episode. So let's get right into it. So like I said, the goal here is to calculate how much money the New York Health Act would save in health costs in a particular district. For the purposes of this tutorial, we're going to look at a county. And actually, we're going to look at the county where I live, Onondaga County, which encapsulates Syracuse, along with a number of other communities in New York. So we are going to be calculating how much the county of Onondaga spends on health insurance for its public employees. And we're going to find out how much of that is a percentage of the total budget for Onondaga County. And then we're going to calculate how much they would have spent on that if the New York Health Act was in place, and how much of a percentage of the budget that might have been. Now, the work that we're doing is going to involve a relatively large chunk of data, and requires you to be careful about kind of where you are putting that data on the spreadsheet. And it's important to follow the steps as closely as possible. I've run through this before, but I might make a mistake over the course of this tutorial, and I think it's important that people see those mistakes, because I want you to know that it's okay to make mistakes, and it's okay to check your work and go back and see how to fix them. So this isn't like an easy project per se. I'm not going to say like, oh yeah, like 20 minutes and you're done, but it's worth doing, and it's worth learning how to do, because as Greens want to have more of a voice on policy issues like that, it's important for us to work with this kind of data and to become familiar with this kind of work, because people want us, well, they are going to question like our credibility about what we're proposing, and having the hard numbers by itself is not enough to win what we want, but it is an important part of it. All right, so going back to our instructions here, this is a chat log from a conference call earlier in the week, so that's not helpful. And all right, so we're going to go to a particular website called seethroughny.net, and it's like a public data website that allows you to look up different kinds of expenditures, and in this case payrolls, so that you can see what different places in New York State are spending on different people or different things. So I've got See Through NY in my web browser right now, and what we're going to do is we're going to look up the payrolls to find out what all of the public employees in Onondaga County are being paid, and then we are going to extrapolate from those payrolls what the county is spending on their health insurance as employees. So we go to seethroughny.net/payrolls in our browser. We've done that already. We want to confirm that our year is 2016. And let's go to, so I'm using the sidebar here to go to 2016. And branch major category is here on the sidebar. We're going to do counties, because I'm going to be looking up Onondaga County. And then under agency, I'm going to type in Onondaga in the search box because that's the county that I'm going to look up. All right, so I've got Onondaga. And then under total pay, write down this number. Oh, total pay is up here. So this is the total amount in salaries that is paid out or was paid out by Onondaga County in 2016. So I'm going to put that just over here as a note. Because we're going to kind of cross-check numbers at different points here. All right, so we've got all these people who are listed. These are all public employees. This is all publicly available data. I'm not doxing anyone by screencasting this. Now, there's a lot of people listed here, and you'll see that there's a button that says load more results, and that will actually generate more people. We want all the names. We want everybody. So we're going to need to scroll down and hit this load more results button to get more people to load until there are no more people to load, because we want to copy into our spreadsheet the amount of pay for every employee in Onondaga County for the year 2016. So a way to make that a little bit quicker, that process of scrolling down and then clicking load more, is on my keyboard, I'm actually hitting the end button. And that takes me directly down to the end of the page. Then I hit the end button again, and that takes me down to the end of the page. So I'm not having to scroll all the way down to the end of the page just with my mouse wheel or with my trackpad every time. I'm hitting end. It takes me, directly down. I'm going to hit load more results. I hit end again. And the size of your county is going to determine how many times you need to do this. For smaller, less popular counties, you may have half as much as what I'm going to load up here. Unfortunately for New York City, number one, it doesn't give numbers for distinct boroughs, which is a real bummer. And it doesn't appear to give us great ways to break down New York City into chunks, and there are many, many, many records for New York City. I haven't tried it yet, but I suspect that it's too many to load up using the method that I'm demonstrating here. So we're still working on the best way to crunch these numbers for New York City, but for just about everybody else, I think we can reasonably say everybody else in the state, this method will work for you. So I just want to highlight that the load more results button is no longer showing, which means that I have employee records, payroll records for every Onondaga County employee for the year 2016 showing up in my screen now. And so we want to copy this into our spreadsheet. You could also copy it into a Word document if you preferred. The important thing is that we want this table to be preserved. Now I'm going to show you another trick, which is that I'm clicking and dragging to highlight these records in my web browser. And you can just let it scroll all the way down to the bottom of your page if you want. But a quicker way to do it is by I'm holding down the left button on my mouse or trackpad, depending on what you're using. And while holding down that left button to keep that highlight, I'm now hitting the page down button. And I'm actually just going to hold down the page down button. And it's going to scroll through that page a lot quicker than if I just scroll down using my mouse wheel or by dragging my fingers down my trackpad. So if you want to do it by just scrolling down your mouse wheel, that's totally okay. Let the computer do the work for you. If you want it to be a little quicker, which I'm doing for the sake of this tutorial, you can hold down your button to keep that highlight and hit page down. And much in a similar way that the end button gets you to the bottom of the page quicker, your page down button will also allow you to highlight those values quicker. All right. I've got these highlighted. I hit Control C to copy the values that were on the web page, and I'm going to add a new sheet, a new tab to my spreadsheet. I'm now going to paste these values into my spreadsheet and see what turns up, and this is good. All right, this has preserved the table values of the web page that I was looking at, because the only thing that I really want is these payment numbers. That's the important thing, right? And so I'm going to hit Shift, and I'm going to hit page down to scroll down through these numbers. And I'm highlighting them much in the same way that I highlighted all of the values on the web page. I'm highlighting them here on my spreadsheet, except in this case, I'm only highlighting the actual salary numbers because that's what we need to work with. Everything else is just going to get in the way. So you have to copy them and paste them into either a spreadsheet or a table in a Word document before you can actually extract those numbers that you want. So I'm just holding down my page down button while I'm holding down my Shift button, and it's scrolling through and highlighting these numbers for me to copy. And it's not hard work. I'm just holding down two buttons on my keyboard, and it just takes a little bit for them to process. You'll notice that the payment amounts, once you get near the end, are quite small. All right, so now I'm just going to use my arrow key, my up arrow key, still holding that Shift button to adjust my selection there. I'm going to hit Control C again, and I've copied just the values that I want to work with, and I'm going to paste them into this empty column on my spreadsheet. Okay, so referring back to our instructions, salary column, got that. I have the entire salary list there. Now, the health insurance payments that your county or municipality pays out actually has something to do with the salary brackets that people are in. So I've got one big column of people, right, who with all the salaries in them. And what I'm going to do is I'm going to copy out the salaries as they pertain to each bracket, so then we can add them up and plug them into our spreadsheet. You'll see that on the spreadsheet we've got brackets for $0 to $25,000, $25,000 to $50,000, $50,000 to $75,000, $75,000 to $100,000, $100,000 to $200,000, and over $200,000. Each salary level needs to be added up and then plugged into the appropriate bracket. So we have one salary here that is over $200,000. So I'm going to copy that out here, and I'm going to paste it into its own column. And now we are going to go for the salaries that are between $100,000 and $200,000. So I've starting here with this row 2, where we've got $175,911, right? And I'm going to scroll down to where, okay, we've got this item here in row 76. Pardon me, $100,536. That is our bracket for $100,000 to $200,000. I'm going to paste that amount into its own column. Now, hopefully you're able to see that when you copy a segment, it gives you this little dotted line around what you copied. And that gives you a little bit of a reminder of the segment that you had just copied. It can be a nice visual aid there. All right, our next section is from $75,000 to $100,000. So I'm gonna, I'm holding Shift. Well, I've clicked the first value that's going to be in this bracket, and I'm doing Shift and I'm doing page down again just to move through this column a little bit quicker. And so we want to copy between $75,000 and $100,000. So this is my last value. We've got one that's just over 75,000. So we've got that highlighted. I'm hitting Control C. And I'm going to paste that into column P for Paul. So the next bracket I'm going to work with is from $50,000 to $75,000. And let's see. So you can see where hopefully you can see where the boundary ended. I'm going to try and zoom in on this spreadsheet just to make it maybe a little bit easier for you to view. Let's see how that goes. Okay, so we're going from, we're in our $50,000 to $75,000 bracket. Okay, so I'm going to page down to move quickly through my column. All right, so moving up a little bit. Okay, so here's where I'm leaving, or I'm picking up, I should say. I'm going to hold Shift. I'm starting from just below $75,000, and I'm going to page down until I get to $50,000 or just above. All right, so I'm going to page back up a little bit. And I'm hitting my down arrow on my keyboard. $50,000, well, how would you even say that? $50,030 is the salary that we're going to pick up at. I'm going to hit, well, that didn't help. I'm going to page back up, or actually I can just use my scroll bar here. All right, and I'm going to put that bracket right over here in column Q. So there's my bracket for $50,000 to $75,000. Now we're going to do $25,000 to $50,000. Now I know it's a little confusing because in the worksheet on the left here, it's saying the bracket is from $25,000 to $50,000. But in one sense, we're actually working backwards because the salaries are listed from highest to lowest. So when I'm sorting through, I'm actually working from $50,000 down to $25,000. So I understand it can be a little confusing. Not too confusing, but it's just something to think about, and I want to make sure that my meaning is clear here. So again, I'm highlighting. I'm holding Shift and page down. We're going to go all the way down to $25,000 or just above that. Oh, here we go. I'm paging back up a little bit. Now using my arrow keys to fine tune my adjustment. So $25,000 and $14 is the salary that we're going to stop at for this bracket. I'm now going to paste that into column R. And what do we have here? $25,000, $50,000, and now 0 to 25,000. So basically everyone that's left. Okay. So picking up at $24,860 and paging down a bit to our very last item in this salary column. I'm going to paste that into column S. Okay, so I'm going to check in on our directions here. I'm going to zoom out just a little bit on the spreadsheet. I hope you can still see it okay. So in our directions, the sequence that we've gone through so far is that we have copied out the salaries in the different bracket such that they are in different columns, right? And so the last salary in column N, note the highlighted row number at the left. This is, what we're going to do is we are going to calculate both the total number of employees in each bracket, and we're going to calculate the total pay for each bracket. So all the salaries added up together in each bracket, and then we're going to plug those numbers into our spreadsheet. So in column N, our first bracket, over $200,000, we only have one person, so that's really easy. And so there is one employee, and that person was paid, $204,250, right? Okay. So now for our next bracket, 100,000 to 200,000. We've got a few more people in that bracket, and so we're going to calculate the number of employees by just highlighting the last salary value in that column and then making note of what row that it's on. Because the salary column is actually starting at row 1, and if it ends on row 75, then there are 75 total employees, and we can go ahead and plug that in here. So we have 75 employees, and you can see how the spreadsheet is actually changing when I enter numbers on this side of it. That's because there are formulas already built into it that are making calculations based on the numbers that we put in. All right, so I'm going back over to my 100,000 to 200,000 bracket, and I'm scrolling to the bottom of it. And if I if I highlight the cell, or I select the cell that's just beneath the bottom, or just beneath the last salary value in the column, and then I hit this sigma button here. It kind of looks like a funny looking E. It's a sigma button. If I hit that, then it will add up all of the values just above that cell. And then I hit the enter button, and it gives me the total number for that column. If you add up all the salaries that are there, and so it's doing that math for us. And I am going to copy that number. because it already did the math of adding up all of the salaries in this column O for me. And I'm going to paste, and I'm going to paste by doing a right click on my mouse, and I'm going to paste only the number. Now, the reason I'm doing that, I did that paste only number, is because I don't want to copy the formula from the cell that I was just in. I want to copy the results of it. So that's what I'm doing here. So we have 75 total employees in the 100,000 to 200,000 tax bracket, and we have a total pay of just over $8.6 million. All right, so I'm going to do this for the rest of my brackets. So I'm going to go to my 75K to 100K bracket, which is over here, and I'm going to page down until the end of that. All right, so I can see that there are 381 people in this bracket, and I'm going to do my formula here by hitting the Sigma button in my toolbar, and I'm going to copy those results. And again, we said, I believe, was it 381? 381. All right, so 381 employees. And now I'm going to paste. I'm right click and I paste only the number. And so we have a total pay of $32 million for that group. So now let's do our 50,000 to 75,000 bracket. And I'm using page down to scroll down again. There's actually a lot of people in this bracket, in the next two brackets. Here we go. All right, so there are, using again the number of rows that we have, there are 1,285 employees. So I'm going to remember that number, 1285. And now I'm going to hit my Sigma button to get the total amount of pay. I'm going to copy that. I'm going to remember 1285 for the number of employees. Let's scroll back to the top. Okay, so 1285. And then I'm going to right click and paste only the number. All right, so that's the total pay for that group, just over $77.6 million. So I've got two brackets left. We've got the 25,000 to 50,000 bracket up next. Gonna, let's, right, sorry, that's this one. I'm gonna actually scroll down because there's a lot of people in this bracket. All right, there are 1,723 employees in this bracket, and I can see that because of the row that's highlighted here. So 1723 is what I'm going to remember. I'm going to hit my Sigma button in the cell just below where the column ends. I'm going to copy that. Remember, 1723 is what I'm going to plug in for total number of employees for that bracket. 1723, and now I'm going to paste the number. All right, now final bracket is from 0 to 25,000, and so that bracket is over here in my column S. There are 508 employees in that bracket. I've highlighted the cell just below the last value, hitting my sigma button, hit enter. I'm going to copy that figure. Remember, there's 508 people in that bracket. And again, I'm going to paste only the number. Now I'm going to take a moment here to actually save my work, and that is an important thing to do as you're doing this work. It would be terrible if your laptop ran out of batteries, or if your computer just unexpectedly shut down after you've done all of that work. So you want to save your work as you go, so that if you do suffer an unexpected crash, you will still have retained the work that you've done up to that point. Okay, so we have plugged in the numbers for our different salary brackets. Now, total pay for this group, $193 million. Does that match up to the number from before? Maybe. Yeah, $193,606,688. That was the number that we copied from the top of the web browser, right? If you remember back at see-through-ny.net, it tells us that there's a total payroll here of $193,606,688. And in my spreadsheet, from breaking this down and then plugging into the formula, I also have come up with $193,606,700. Now that's a little bit off. So let's see how off that is. Okay, I'm $22 different. So I'm going to call that a negligible difference, and probably not my fault. But we know that our total pay for the group is within $22 of the total pay that's reported on See-Through-NY. So that tells us with a high degree of confidence that our work is accurate up to this point. All right, and we have a total of 3,973 employees. Let's see how that matches up with the report. 3,973 results, right? So that means we didn't, accidentally skip anyone or accidentally copy over any values multiple times. The website tells us there are 397. I keep mixing up my thousands and hundreds. There are 3,973 employees listed here, and we have 3,973 employees that have been added up based on the number of employees that we have pasted into our spreadsheet over here. Okay, so let's go back to our instruction sheet and see what it wants us to do next. So we enter total number of salaries. We did that. Okay, total budget. This is the next kind of major phase of our project, right? We have tallied up what the county spent on salaries, and we want to compare that with what the county spent overall, right, for the whole year. Now, this is going to require a little bit of Google sleuthing on your part. You've got to look up your county or town, whatever it is that you're trying to crunch these numbers for. You have to look up their budget for 2016, and you need to get a sense of, well, number one, you're going to report what the total 2016 budget was, what their medical expenses were, and then what percent that was of the budget. And again, the spreadsheet will do that math for you. We just have to figure out what the what the total budget was and what the budgeted allowance for medical expenses was. So I'm going back to my web browser, and let's see, let me just look up, I'm actually going to look this up in a different browser than you can see. 2016 Onondaga County budget. That's what I'm typing. Okay. So let's go back to here. I'm just opening up a new tab. And if I just type in 2016 Onondaga County budget, in my results, I see a PDF for Onondaga County, New York 2016 adopted budget. And that's what we're going to use, actually. Well, actually, there's this budget documents on this page that might even be more helpful to us. Let's see. This is all for 2017, so that's not super helpful. 2016 annual budget. Okay. Well, there's the PDF. So I'll just click there. The important thing is that in my browser, I've got the Onondaga County of New York 2016 adopted budget. So we're going to use the find function in our browser to find what we're looking for, because this budget has hundreds of pages. It's 524 pages long. You don't want to print that out and comb through it line by line. Not efficient. And maybe you'd like to. Maybe you would enjoy that reading. Maybe that's fun summer reading for you. But I got other things to do. So, and you got other things to do than to watch me read through this budget page by page. So I'm going to hit Control F on my computer, and I'm going to attempt to find in this page total budget? No. Maybe. There we go. Total budgetary funds. That looks good. Well, let's see. Total budgetary funds. Let's see. Appropriations, revenue, appropriated fund balance, total budgetary funds, 2016, adopted. Okay, great. So organization summary, revenue totals by fund, total budgetary funds. What I want is like the total expenses, whereas the total budget of $1,263,196 as modified includes. Okay, great. So here it refers to the total budget as being just over $1.2 billion. That also comports with the table up here. So I'm actually highlighting this and hitting Control C. So that's our total budget for 2016. Going back to my spreadsheet, and I'm going to paste that in here. So we have a budget of just over $1.2 billion for the county. Now I need to figure out what is the 2016 medical expenses, right? And it gives you some hints in the instructions as to what to look for that. The figure will be listed in the budget as an employee benefit. Depending on the municipality or district that you're looking up, you might need to call them up and ask to speak to an accountant or ask for clarification. We're trying to calculate how much was spent on healthcare for all of the public employees for that jurisdiction. So it gives you some account codes that you can look for. It gives you some keywords like health insurance, dental, under employee benefits. So I'm going to search for medical insurance. Okay, no matches for that. Health insurance. Oh, we got a hit. got 2 hits. Okay, medical assistance, public health insurance, or Medicaid. All right, this is under social services, so I'm actually going to look at employee benefits. And that gives me a lot. Employee benefits. All right, so we have a table here under employee benefits. I'm just using the find function that's actually built into my browser. All right, so 2016 employee benefits. We've got health and we've got dental. My understanding is that those are built in, those would both be covered by the New York Health Act. So, so this is the 2016 adopted column over here. So I've got just over $70.3 million for health and dental. So I'm actually going to see if I can copy both. Nope. Okay. So I'm going to copy the $70 million figure first. And I'm actually just going to paste that right over here, just to the right of our conclusion. I'm going to paste that here. And I'm going to go back to the table and I'm going to copy the dental figure, and it's just over $2.7 million. And I'm going to copy that and I'm going to paste it right here. And you might recall from before when we used the sigma button to calculate figures, I'm going to actually use that here, the zoom button, and it automatically tallies up those two numbers. I hit the enter button, and it puts me at just over it puts me just over $73 million, which makes sense because we had $70 million in change and $2 million in change. So I'm going to copy that, and I'm going to paste just the number there. And so we have our total 2016 budget of just over $1.2 billion, 2016 medical expenses of just over $73 million. For the percent of the 2016 budget, it's we spent 5.78% of the annual budget on employee health care for public employees in Onondaga County. Now, the numbers that I have over here, these were calculated for us by the spreadsheet based on all of the employee data that we put in. So the spreadsheet is telling us that under the New York Health Act, the county would have only had to spend 0.63% of its annual budget on healthcare costs for its public employees. So we have a comparison of 5.78% of the budget versus 0.63% of the budget. So going from almost 6% to below 1%. That's a huge savings. Now, what does that mean in terms of actual savings? Well, in terms of dollars, not just percents. Well, we have that number here. It would be just under $8 million under the New York Health Act is what the employer, in this case the county, would have spent, versus $73 million of what it spent in 2016. So, 73 million minus, 7.9 million, that is at least, well, let's just go ahead and call it 8 million. 73 minus 8 would be 65 million. So the Onondaga County would, in 2016, have paid $65 million less on employee healthcare costs under the New York Health Act. That's huge. $65 million for a county is a lot of money. You can do a lot with that money. That's a lot of improvements to schools, after-school programs, infrastructure improvements, services for the differently abled, food security measures for for people who are facing food insecurity and hunger. That's a lot, and that's a great line to include in your campaign if you're running for local office. That in our county we could have had an extra $50 million or $40 million or $30 million to spend on improving people's lives if we were in a system where healthcare was a human right, where everybody was in the same public plan, and if we were getting better healthcare outcomes for a lot less money. So we did it. We crunched the numbers. This theater manager managed to get you through the process. And hey, if I made any mistakes, please do let me know. Post it in the comments. But it can be done. It can be done using free open source office software. And this is powerful information. This is the kind of information that Greens need to have to help establish our credibility when we're talking about the kind of policies that we want. Now, it's not like the whole thing, right? We are not going to motivate people to get in the streets for healthcare as a human right on numbers alone. In fact, the numbers are a relatively small part of the message. What we really need to do is get people talking about how they have faced barriers to what we consider to be a human right, and that there's a better way, right? And to get people to understand that there's a better way, and we can win that if we collectively organize. So I hope that this tutorial has been helpful to you. I want to circle back to our GPNY website. Again, if you go to gpny.org/healthcare, you can find the instructions and the Excel spreadsheet that I used to calculate these savings. And then you can also find outreach material, which will be supremely helpful for the upcoming day of outreach on September 23rd, that we are asking Greens to participate across the state. If you are running a Green for office, for elected office in your community, then it is suggested that you focus on the New York Health petition and include that as part of your door-to-door canvassing. If you are not currently running a Green for office in your county, then you might want to focus on the healthcare survey, where you can actually spend more time having an organizing conversation with your neighbors and members of your community to give them a chance to talk about where maybe they or a loved one have suffered under this ridiculous, inhumane, unjust, for-profit health insurance system, and let them know that their story is being added to the stories of many other people who face the same thing. And if all the people who have been kicked in the teeth by this healthcare system get together and collectively organize, then we can win a better system. And you're going to be forging relationships with people in your community that are invaluable for the kinds of local struggles that you can engage in together, and in a way that they see that you as members of the Green Party are out fighting for a better world for your neighbors, for your community members, and for New York State, and ultimately for the world. So again, I encourage you to go to the New York Health website and look for the September 23rd community outreach, statewide outreach action, and it should be listed under their upcoming events, or it's going to be listed on the blog. And there are ways to sign up to be a canvassing team leader. You are fully empowered to do that, and not just like you as Greens, but other people in your community who are interested in this issue. We encourage Greens to be part of this coalition, right? To work with other people, other like-minded activists who are fighting for healthcare as a human right. This is a great way to build alliances and friendships and learn from people and hopefully they have a chance to learn from us as well. And so we will continue to push this coalition and to build our involvement in this necessary issue. That has been how Greens get things done for this week. Thank you for sitting through that tutorial. I look forward to your questions and comments, either in the comments of this video, or you can email me at michael@gpny.org. Again, that's michael@gpny.org. My name is Michael O'Neill. I'm the staff organizer for the Green Party of New York, and I talk to you every Sunday at 4 p.m. Eastern Time, and I share with you tips and tricks and techniques for how to get things done in your local campaigns and in building the Green Party. Thank you so much for joining me. This has been fun. Numbers are not my strongest suit, but when you actually get it to work, it's pretty cool. It's pretty cool to see things come together. So again, thanks so much. Please spread the word about these live streams if you find them helpful, and I will see you next week.